Hi there. So today I'm going to talk about looking after your spinal fusion surgery in the best way possible. Now, I had mine done in 2001. I had titanium ones in my thoracic spine with screws at the top and the bottom. So that is called the Harrington style. So most of the operations, they don't do that one anymore. So most people are having more screws put in with each joint. So the caretake of that will be slightly different from the Harrington style, which I'll talk a little bit about both, but obviously I know a lot more about the style that I have, which can have more problems, which is why they've changed it to the new style. So one of the problems is that first and foremost, you have to make sure that you let your rods heal properly. So you have to rest. I had to rest for 6 months before doing exercise. And you have to allow the healing and the scar tissue to hold the rods in, because when you only have screws at the top and the bottom, you're relying on, the scar tissue and where it heals to then hold the fusion. So even though the bones are fused and they're taking, however many discs out, actually it is where your soft tissue then heals, which is going to create then where your body builds protein, where blood goes. It's going to be part of a new neurological proprioceptive field. So don't do what the doctor says, take the antibiotics you need, because infections can come, or painkillers, so that you're comfortable and you're not jerking or agitated as much, because you really just want to get flow and rest and eat well. So make sure you rest enough in the straight position. So I always, I had to lie on my back after the surgery, even though it was so uncomfortable, sleep at night. I couldn't lie on my sides to start with. I had to lie on my back with lots of cushions and things, sometimes even tilting up a little bit to help my breathing. You can use cushions to support, areas of lungs that are not getting as much breath in. You can put the cushion underneath that part you want to breathe more into. But so to start with, I hear it's 3 months for the new style of fusion, so you don't have to rest as long. And make sure you eat like really high protein, high fat foods that are going to just get you that bulk and support to your new soft tissue fused position. So secondly, kind of obvious, but when I had my surgery, I wasn't given any advice by my surgeon. So kind of obvious, but don't do anything to break the rods. And a lot of stories I hear are people doing back bends. And usually it's the oldest Harrington style rods that will go all the way up, and just one rod all the way up and down, that seem to have the most breakages and stories that I've heard. So again, more recent surgery, you're probably all right. It's probably unlikely to break, but just always be careful. Just have common sense, even if your doctor doesn't, even if they tell you can do anything. I was told you can be a professional ballerina, because dance was my passion. And I did go on to do professional dance, not ballet, obviously, with rods. Didn't feel like a good idea, but just dancing in general, which again, probably wouldn't advise someone to take up a career in that with the rods. Just a lot of pain, really, really, really. You have to be really athletic and strong. But it is possible. Okay, so next thing is that you obviously, to start with, before you start doing any exercise, you need to make sure that you're eating well, and you have to, if I could turn back time, I would start off supplementing straight away and taking things that are going to help detox, because the metal work is metal. It can leave heavy metals in your system and it can attract bad bacteria. So I like tree resins like frankincense and myrrh for killing bacteria around the rods personally, but there's lots you can take. And I like chlorella. I like green powders to clear toxins and heavy metals from my system. So yeah, I would change how I ate. If I could turn back time, I would eat just more protein, more high fat, and also I would eat. I tried being vegan vegetarian, but I would eat a more alkaline diet to reduce degeneration. But I wouldn't really advise going vegan or vegetarian. Well, maybe vegetarian, but not vegan as much. After, especially if you've had this surgery, because it's just easier to get blood flow and open up the blood in the scar tissue. Eating meat, you just get more quick protein, and you spend a lot of energy. Scoliosis, you're using up, I think I saw someone say, around 30% more energy. And then if you had the surgery, your body is constantly got to support the rods as well. So there could be more like constant tissue damage, like as if you was an athlete and you was exercising all the time. You really need to eat more than the average individual. Next thing, with all this eating, look after your teeth because I didn't realise that it was a thing with scoliosis, that because the rods are right there by your throat, that teeth infections can spread to the rods. And I had this filling that kept coming loose, and it built to a really bad infection, and it made me critically ill. It spread to all the scar tissue and the rods, and it was like going in my system. It made everything go into like a spasm. It was a horrible experience. I was actually fighting for my life. So yeah, don't look after your teeth. Go for regular dental checks. Another one, I'll go on to the exercises, but you must rest enough, because you've got metalwork there. You're always going to be it's like you're getting more and more tissue damage and repair, like constantly, like as if you was lifting heavy weights, regularly. So you need to rest more than the average individual. And I love spas and hot bath, hot spring, volcanic mineral, and like Dead Sea salt baths as well, and clay pastes on my skin. So yeah, and regular meditation and breathing exercises to calm the sympathetic nervous system and increase the vagus tone in the body. So yeah, regular rest and relaxation and meditation and all that stuff. So then we're going to move on. Well, I'll do the exercises last. Along with regular rest, you also want regular massage, probably. Obviously not straight after the surgery, but as soon as you start being active again and using your muscles, you want very, very gentle massage. And there is a special type called scar work, which is part of structural integration or rolfing. So it's working on the fascia and the soft tissue, and it's just really, really gentle, light touches that are going to help your proprioception. So where it's numb after the surgery, it's going to help you gain awareness and proprioception back, and it's going to allow like bits to like relax and release that were gripping on that don't need to be anymore, because you've built more muscle strength. So obviously you have to have built that strength and support first before the fascia will release and let go. But yeah, Scar Work by Sharon Wheeler is just good for breaking adhesions and helping you gain more awareness of the new surgery. Because and I had my scar massage done by Jan Truartha, and I was amazed that the scar tissue went into my lungs where the chest drain was. Even where they put the catheter in, there was some, and the epidural. So she worked on where they put the epidural in, and I couldn't believe there was tension in my fascia and scarring there as well. So there's lots of places where you just become completely numb, and the blood flow and the nerve supply is a lot less, and that can become very dehydrated with time over the years. So yeah, you really want to start early on as possible after you've like healed and, you know, got active again and built up some strength. You want to have some regular massage along with your relaxation. I think like bowing technique is also a good one for really gentle work. And another one for relaxation is heat, and infrared heat is my favourite for getting blood flow to scarred tissues, and for the bones and joints in general. So yeah, I love anything with infrared heat. And now, and obviously choose a suitable career. Don't be a professional dancer. But yeah, obviously I couldn't sit still after my surgery, so ideally now they adapt office spaces so you can stand or sit, and you can go like walk around for a stretch. You know, they acknowledge like these sort of things in offices now, that health and spinal health is important. So I would probably do a different career looking back now, but at the time I tried office jobs and they were just making me sit in this same position, and I hated it, and I left. and I ended up doing jobs that I shouldn't have done, where I was bending over, like lifting weights that were too heavy, stacking shelves, bending, and because I'd done my physio degree, I had to do like bending over beds with patients. And I worked in care homes for a bit to get that experience of the health system. Again, not a good idea if you've had a spinal fusion surgery. All these things you can do for a little while, you know, number of years. But yeah, over the time, wouldn't advise any of these jobs full time. Even being a massage therapist, which I'm qualified in as well, is not something that I would do full-time regularly with a fusion. So no lifting really heavy weights and no bending over and jobs where there's a lot of that stuff. So yeah, you really have to use your common sense, and I hope surgeons advise people better now. So yeah, now on to the exercises. So care of your fusion. First and foremost, it has to be around getting strength and core support around the area that's fused. So Pilates was one of the first things that I tried out. And yoga for scoliosis is really good, because it's giving like options with equipment and TheraBands and things to gain awareness. You can have people specialising in yoga for fused scoliosis. And yeah, both yoga and Pilates are very focused. There's a lot of planks, so as long as you're not doing anything that's twisting, you know, where the rods are, yeah, definitely anything that's going to support and hold the muscles there. And don't do anything that is going to cause too much movement above and below, because disc problems are really common there. So nothing that's rotating or swinging too much in the hip and the head and the neck. Nothing that's lifting anything too heavy above, or anything that's impacting. I wouldn't do any impact sports or anything too aggressive like martial arts where you get chucked on the floor on your back. But yes, to start with Pilates and yoga with TheraBands. And then I would move on to somatics for fusion. So more, again, you know, in line with the massage. It's just all about gaining more proprioceptive awareness in line with your new fusion, because one of the reasons fusions fail is because people's curves try to pull back. Some people do it aggressively straight after the surgery, and it can cause the rods to break. Others, just gradually over the years, the person's proprioception is not aligned with the new position of the surgery fully, and the curve just gradually starts to pull back in its normal pattern, and it can create a lot of pain and wear and tear at the fusion site. So you need to really be trying to gain, as well as strength and support around that area, proprioceptive awareness as much as possible. But be careful of doing this too fast or too much because you can develop post-traumatic distress syndrome. And also don't go too deep into it too fast with any meditation or any awareness. Because it was a very traumatic thing, the surgery. So very gradually, slowly does it over years. And then and obviously weights are good to work on. It's good to work above and below the fusion area, to stabilizing and strengthening the hips and the shoulders, particularly with weights. Doctors recommend, doctors recommend swimming straight after, but I wouldn't do too much swimming, because if you're just swimming all the time regularly, it's okay if you've got good proprioceptive awareness and good muscle strength around the rods, then that's great, that's fine. But if you're quite numb you're making, so swimming's good to reduce inflammation in the body and take pressure off joints, after surgery, and to do, regularly in general. But if you do too much and you're like rippling and sending too much flow through, you can create spasms in the body and build up too much hydrostatic pressure, which can lead to more compression or disc problems or things like that. So be careful that when you're swimming, you're not overdoing it, and that you're doing it, with strength and awareness. I loved cycling for a while, but then I stopped doing that because of the neck, it hurting my neck. And walking is by far the best things you can do, but again, don't overdo it. Don't be walking up too many mountains. And rowing. I always use the row machine at the gym. That's the main one that I do to warm up, and mostly other things I do are like all TRX and TheraBand things, and and free weights, like lighter free weights. But I don't really. There is a great book called The Scoliosis Handbook by Caroline Friedman that advises on gym equipment. So I just kind of avoid most of that. But I like hanging, so I like bars and chin-ups and anything to do with wall bars and climbing, but not too much climbing because you don't want to disjoint anything. So you just really have to plan what you can and can't do with your fusion. So this is just a general talk about caretake of your metal rods and your fusion, and remember that it's there for life. With the older styles of fusions, I've seen some people having the rods taken out, but that's going to create more scarring, and it's another dangerous surgery. And really, you really want to try and embrace and work with the metalwork and with the new myofascial position that you've been put into, which is a lot straighter than it was. So your challenge and key is over the years to really try and neurologically match that new position and your awareness with that, and build up a new strength around the straighter spine. In a very slow, so having the rods will make you work even slower on yourself than if you didn't have the rods. So you're going to be making progresses and gains over decades, rather than years, like probably normal people. Everything is much slower and more gentle and careful. But you can make progresses, and you can build strength, and you can avoid, you can reduce pain, and, it doesn't have to be a constant issue. Although inevitably, the older you get, the stiffer things are going to get, because they're fused in that position and it's never going to change. So the main thing, lesson learned here, is be gentle on yourself, be very patient, and make sure you rest enough and eat well enough. And scoliosis, and especially having the fusion, really is a challenge and wake up call to, you learn a lot about looking after your body and treating your body well. And yeah, it's just a journey to go on, really, and there's a lot to learn with scoliosis. And the fusion can teach us new things as well. So yeah, onwards and upwards, and peace out to everyone. Thank you for listening.